of Ottawa. Thanks so much for coming back on.
It's my pleasure.
So what do you think about making the rules more strict?
Well, we have to do whatever it's possible to make the schools as safe as possible. And we kind of know what to do. We know we have to change the built environment, things like improved ventilation. That might be difficult in short order. We know we have to change the scheduling to allow smaller class sizes. That might be possible. We know we have to encourage, or if not mandate, as much mask usage as we can indoors, including making sure high-quality N95 respirator masks are available. And we know we have to increase, if not mandate, vaccine usage for everyone who is eligible to do so. So there are things that can be done, and I'm hopeful that we are doing those things.
Ontario only requires kids as young as grade 1 to mask up. I guess the issue there is it effective if the younger kids are wearing the masks, but they're playing with them or removing them, or as one of the listeners texted in, they're licking the mask?
Yeah, I'm sympathetic to the young kids. It may not be possible to compel them to wear a mask, and maybe we shouldn't be doing so. Maybe they have greater need for facial recognition and expressiveness, more so than older kids. So I think we have to be able to work around the inability of young kids to wear masks. That means the other things that I mentioned, making sure that everyone they come into contact with is immune, or at the very least, not infected, and making sure that the built environment is not conducive to infection. So the question of whether or not young kids can or should wear masks is really a pediatric medicine question, not an epidemiological one. Epidemiologically, everyone should wear masks, but it may not be possible for that demographic.
Right. And what about the mandatory vaccinations for everyone, not just the staff, but people who come onto school grounds, like volunteers, people that are doing work on the premises?
100%. That's low-hanging fruit. We can do that, and it makes sense to, if we cannot vaccinate the children and keep them perfectly safe individually, we at the very least should make it possible that everyone they come into contact with is not conducive to infection. That is the absolute simplest thing we can and should be doing. I know there's going to be arguments that not everyone can get vaccinated for medical purposes, and that's true, but the people who can't are a tiny, tiny minority. I'd be surprised if it's more than a handful of people in Ottawa. And we can't be accommodating the vaccine hesitant too much on this front. I know there's a pushback saying for those people who refuse to get vaccinated, we should compel them to just do regular testing. That is burdensome, it's expensive, and it's not as effective as compelled vaccination. So yeah, I think if you want to be on school grounds, you should be vaccinated if you're an adult.
Let's go back to the masking rules that have been handed down from the province. So it is only covering grades 1 to 12, but they're discussing that, potentially expanding it to the kids in kindergarten. That's at issue tonight. The masking rules from the province also say the masks can be removed inside to eat. Okay, that makes sense. And for physical activities, including high-risk contact sports like basketball and hockey with some distancing requirements. What's interesting about that is that Dr. Etches wants to go beyond it, and she's recommended, not mandated, but asked that people wear masks during physical activity inside. What do you think of that?
Yeah, we should. Look, we know that COVID, especially the Delta variant, spreads by aerosol transmission. That means all it takes is a few particles of virus to be in the air in an indoor environment, to linger for hours, and for someone to come along and breathe it in later on. And if you're exercising, you are expelling a lot more viral load into the air than otherwise, if you are indeed infected. So it makes every bit of sense that, especially in these high exertion activities, we should be masked. I know it's hard. It's not ideal. Maybe we should be looking at different kinds of physical activity for this semester that maybe are more conducive to mask wearing. But yeah, I think Dr. Etches is correct on this front. We should be encouraging mask wearing, not looking for more opportunities to exempt mask wearing.
Meaning perhaps not high-intensity cardio-based activities like
Exactly.
When you're playing basketball, not that I'm a basketball pro or anything, but you are perspiring.
That's right. But if you're outdoors, that's another story entirely. We're talking here about indoor activities, and the aerosol transmission is far more meaningful indoors. If you're outdoors, I'm more forgiving for a mask exemption.
314, chatting with Raywat Deonandan right now on the line about some of the different things that are being discussed tonight. And I just want to zoom out a little bit and talk about the situation in Ontario right now. I guess I'm trying to reconcile what's happening because on the one hand, we're seeing that things are not deteriorating at a level where the experts are exceptionally alarmed, but we're also hearing from people like Dr. David Fitzman that the projections are grim. Dr. Karen Moore came out and said it's going to be a difficult fall and winter, and yet this is where we are right now, and I think people are confused about what lies ahead. How are you feeling about the fall and winter?
I'm feeling disappointed in myself because I thought we'd be done with 3 waves. I failed to consider 2 things: the intransigentness of intractability rather of the Delta variant and the slowness of the vaccine uptake. So given those 2 realities, we are looking at a fairly bad 4th wave. But it is a wave almost entirely of the unvaccinated. So the frustrating part of this is that it's entirely avoidable if we just encourage those holdouts to get vaccinated, and for everybody else who can't get vaccinated, wrap them around with services like mask wearing and making sure the people they come into contact with are vaccinated. So this is avoidable, 100%. And even though there are a fewer number of people who are susceptible this time around because of vaccination, the Delta variant makes it more likely that those remaining susceptible people will be infected because it's so lightning fast in its infection capacity. So will we see closures? I don't think so, but we will be seeing a busy hospital system. And that is the concern here.
That being said, more than 82% of people in Ontario have 1 dose of the vaccine and 75% are fully vaccinated. So we do have that amount of coverage, but that's not enough based on what we're hearing about the projections?
Yeah, exactly. 25% of the population is not fully vaccinated. That means 25% of people are technically susceptible. And 1 dose is nice, but Delta doesn't care a whole lot about 1 dose. So 25% of 15 million people is a fairly large number of people, and that's who we're looking at that might clog our healthcare system. Now, it's important who these people are. They're mostly younger, so they're less likely to be seriously ill, less likely to die, so the death rates won't be as high as they were in waves 2 and 3, but the hospitalization rate might be. In the USA, we're seeing amongst very young people, 1% of all infections end up in the hospital, and a third of those end up in the ICU. And those aren't large proportions, but small proportions of large numbers are large numbers. And Delta, again, being hypertransmissible, makes it likely that these small proportions will result in large numbers. That's the tricky part here. It's the law of large numbers.
So they're trying to push now, and the Ontario government has launched its last mile strategy. This is the way that they're trying to focus on smaller community-based settings. They're looking at areas where vaccination rates are low. And in some case, Raywat Deonandan, they said they may contact people who haven't booked in for a second shot. How far do you think that'll get us?
It'll get us a little far. It won't solve the problem entirely. Look, making the Pfizer vaccine non-emergency use in the USA helps a little, but not a lot. Calling people up and nudging them towards vaccination is going to help a little, but not a lot. What we need are the professional persuaders, the advertising experts to step up and offer their insights into how we encourage people to take those last few steps. Doctors and scientists like myself really don't know how to convince people to do things. Right? We have an entire professional body who make a lot of money, who have dedicated their lives to persuading people to do things. Let's bring them on board.
Raywat Deonandan, great to get you on the show. Thanks so much.
Thank you.